One local cardiologist cheered the new definition of high blood pressure, but said it could leave some doctors and patients confused about what to do next. About 30 million Americans were newly diagnosed with high blood pressure hypertension Monday after a change in guidelines lowered the threshold for the condition. High blood pressure, or hypertension, is now defined as a reading of 130/80 instead of previous threshold of 140/90. Nearly half of all adults are now considered hypertensive compared to about 1/3 under the old guidelines. The new high blood pressure rates for African Americans are even higher, reaching nearly 60%. High blood pressure is a risk factor for stroke, heart attacks, cardiovascular disease and death. Dr. Andrew Cates, Washington University cardiologist at Barnes-Jewish Hospital, answered questions about the new guidelines. Q. Was the change influenced by pharmaceutical companies eager for more patients to take their drugs? No. The guidelines were announced at an American Heart Association meeting and are based on new data. Most people who are newly classified as hypertensive can bring down their blood pressure through lifestyle changes including weight loss, exercise, sodium and alcohol restriction, smoking cessation and stress reduction. Those with stage 1 hypertension 130 to 139/82/89 who don't see an improvement in 3 to 6 months may need to consider medication. Not all those people necessarily need to be treated with medications, but all need to have lifestyle changes addressed, Kate said. Q. Who should take high blood pressure medication now? People who are now defined as having stage 2 hypertension, with readings of 140/90 or higher, should probably be on medication, Cates said. Most people older than 65 and those with diabetes who have a top reading of 130 or higher should also be on medication, according to the new guidelines. Otherwise, doctors will use a combination of factors: age, gender, cholesterol levels, smoking status to determine whether a patient should be on the drugs. People sometimes feel like they're failures if they need medications to treat blood pressure, but the whole goal is to help people longer and healthier, Kate said. Q. What causes high blood pressure? There is a genetic component, but unhealthy habits including poor diet, smoking and lack of exercise are thought to cause 90% of cases. Q. Why should people try to lower their blood pressure? The risk for heart disease and stroke doubles with every 10-point rise in blood pressure. The challenge for doctors is that many people with high blood pressure feel fine, which is why it is called a silent killer, Kate said. The idea of taking medications when you feel good can sometimes be difficult, but we do ourselves a disservice by not being more aggressive in treatment, he said. Q. Are there risks in overtreating people for high blood pressure? If someone's blood pressure drops too low, falls and fainting become a risk. Q. What about natural remedies like meditation? The guidelines say there is not enough evidence to show that yoga, meditation or other behavioral changes can reduce blood pressure. The data is also scant on dark chocolate, coffee, tea or garlic as remedies. Q. How often should blood pressure be checked? At least once a year for most kids and adults. High blood pressure is only diagnosed after several readings on multiple occasions. Some people have white coat syndrome, meaning their blood pressure rises automatically in a doctor's office or medical setting. Those people should try Atome or automatic blood pressure cuffs found in pharmacies or retail stores. Everybody should know their numbers and know their risk, Kate said.